Hi everyone, my name is Dr. Niamh Cummins. I'm a research fellow in pre-hospital and emergency medicine at the University of Limerick, and I'm here to speak to you today about the impact of COVID-19 on an Irish emergency department. So I'm obviously here to speak about a public health issue, but it's actually not COVID-19, it's emergency department crowding, which has arguably claimed more lives in Ireland over the years than the COVID-19 pandemic. I'd like to start with this quote. The causes of ED crowding involve a complex network of interwoven processes ranging from hospital workflow to viral epidemics. These are the conclusions of Huge and Aronsky in a systematic review in 2008. In 2006, there was a new record in terms of overcrowding and the trolley crisis in Ireland. 384 patients were waiting per bed. This was declared to be a national emergency by the Minister for Health at the time. In January 2020, a new record of 760 patients on trolleys nationwide in a single day was recorded. You can see why the COVID-19 pandemic could be termed a crisis within a crisis. In terms of the epidemiology presented here, these stats date from July 2020, and at this time there were almost 1,500 deaths in Ireland during the first wave. Each of these is a tragedy. The aim of our study was to describe the profile of patients attending the emergency department and also to investigate the factors influencing attendance at the ED from the patient perspective. To put into context the timeframe of our study internationally, we know that the WHO declared COVID-19 to be a pandemic on March 11, 2020. This coincided with the first death in Ireland from COVID-19. And the following day, on March 12th, all childcare, schools and universities were closed. On March 29th, the country went into full lockdown and a stay-at-home order was issued. This remained in place until late May when a phased reopening began. By July 2020, the final time point of our study, there was limited services, retail and inter-county travel permitted. The setting for our study was the ED at University Hospital Limerick. This serves a mixed urban-rural region with a population of almost 500,000 people. At each time point, December 2019, February 2020 and July 2020, we conducted a 24-hour census and all adults presented to the ED during this time were eligible for participation. So what were our findings? So we actually found that the clinical and demographic profile of patients attending the ED across time points didn't change. However, there were some modifications in regard to health-seeking behaviour, and post-lockdown patients were less likely to attend for reassurance, to obtain a second opinion or to see a specialist. There were significant changes with regard to operational metrics, particularly in relation to length of stay and disposition outcome. These related to local changes in the protocol with increased utilisation of the medical assessment unit and the surgical assessment unit. This was made possible because of increased bed capacity in the hospital as a result of the cancellation of elective care across the health service. This removed the access block in the ED to admissions. This cancellation of non-urgent and elective care actually drove presentations to the ED, with 44% of patients reporting difficulties in accessing services in the community, including general practitioners. 9% of patients in our study reported delaying presentation at the ED due to fear of infection. The increased morbidity and mortality as a result of delayed care is termed the collateral damage of COVID-19. This is particularly of concern in time-sensitive conditions such as stroke. So what were the implications of our findings? Once again, the study has demonstrated that the solutions to ED crowding actually lie outside of the ED. Our findings are relevant to policymakers in terms of planning future services and also preparing for future emergencies, including pandemics and potentially cyber attacks, which we're covering from in Ireland. One final point. In May 2020, the Irish Association for Emergency Medicine issued a statement, Resetting Care in Ireland's Emergency Department. This called for improved infrastructure, particularly bed capacity, and increased staffing in Irish emergency departments. Almost a year to the day later, in May 2021, just a few short weeks ago, we reached a new record for emergency department crowding with 314 patients on trolleys in Ireland. This isn't sustainable with the risk of infection in the COVID-19 era. It looks like we may be heading for another winter of discontent. And unless imminent action is taken, the public health issue of emergency department crowding will remain with us far beyond the COVID-19 pandemic. I'd like to conclude by thanking our participants and our amazing clinical staff who participated in this research study. Thank you for listening. Please get in touch with any questions or comments and enjoy the rest of your conference.